Welcome to MedAxiom HeartTalk, the podcast where cardiovascular thought leaders come together for one ultimate goal: to continually advance cardiovascular health care for all. MedAxiom HeartTalk starts now. We are so pleased to have Dr. Brad Hubbard from Michigan Heart with us today. He has made a presentation about starting an A-fib clinic from scratch, and we are going to follow up with him and learn more about that. So welcome to you.
Thank you.
And just the title alone sounds like a huge undertaking and a complex process. So what are some of the very first steps an organization should take in this process?
I think that for us, we wanted to take a look at our atrial fibrillation. It's a large percentage of our population, and there hasn't been much work done in the past as far as reducing atrial fibrillation admissions. And yet, as we look into population health, I think that's an important thing to be looking at. So we started looking at that. Our first step was actually to set up a program in the emergency room where we reduced atrial fibrillation admissions, and we reduced it by around 27%. And we've been able to sustain that over the last few years. We presented that at the MedAxiom back in 2014. We'd started actually an A-fib clinic at that time to handle the access of those patients, because as we sent patients out of the emergency room with atrial fibrillation, we had an understanding that we would see those patients within 48 hours in our office. So access was important. But what we found over the last few years was that patients were not seen as efficiently as they could be, and so we really worked more recently to try to analyze that. I think the biggest issue as you start to look at an atrial fibrillation clinic is to, number one, set your goals. What is it you're trying to accomplish there? And then number two is, I think it's modeling how you're going to work through that. And then three, I think having the stakeholders, the proper stakeholders, and getting opinions from stakeholders. So we had APPs sit down, electrophysiologists, cardiologists, administrators, and then we got input from primary care physicians as well, since they would be impacting on that.
So you originally presented, you said in 2014 on this, so we're 4 years later. And so now you've come through with successes and lessons learned. What were some of the lessons learned?
Right. So it's interesting, when we presented in 2014, one of the things that we wanted to try to accomplish at that time was access, as I said. The second thing is that the new A-fib guidelines had come out, and we felt that certain number of patients would really benefit from A-fib ablations or more aggressive procedures. And so we wanted to have the patients seen, appropriate patients seen by electrophysiologists. So in our first iteration of our A-fib clinic, the head of our electrophysiology department asked that all these patients be seen by EP. Well, we ran into the conflict of access versus being seen by the appropriate specialists. So we eventually evolved then where the patients were seen by an APP first. But then staffing of those APP patients were often done by a non-invasive cardiologist. And so our ultimate goal of trying to have more patients seen by electrophysiologists was not accomplished. So that's where we evolved to our more recent model.
Okay. And what are the operational, financial, clinical, and patient outcomes expected from an effective A-fib clinic?
Yeah, so I think that number one is improving your access and growing your program. I think that was very important for us. And in the process of reducing people being admitted to the hospital, we knew that we'd be seeing more patients in our office and at least seeing them sooner. Two then is to get the patients through very quickly. Three would be patient experience. Now, one of the things we've seen over the last 2 years is our A-fib volumes are going up. And for an administrator to finance additional FTEs, they've got to see some growth of some sort. Our ultimate goal was not to increase our A-fib volume, though we thought that could be a secondary finding, and we have seen that. So our A-fib volumes have gone up. So many people put so much stock on the protocols that you use in the clinic. I think the protocol is important to have a protocol. I don't think it's as much the protocol that you use in the clinic, but really, again, looking at the flow of the patients through.
Okay. Wonderful. Are there any final thoughts on this to share with the audience?
Yeah, I think that when you're looking at the clinic, I think what you want to do is number one, is to try to get your APPs up to the highest functioning level. And we felt that we could do that primarily by taking a core group of APPs, training them up so that they could function independently. as opposed to having a larger pool. It's a balance because you need a large enough APP pool that you have access, but you have them trained. 2 is then trying to get the proper patients to the non-electrophysiologist and the electrophysiologist. So we've tried to triage that. 3, then we took advantage of other programs we had. So we modeled our valve clinic and we set up a virtual clinic so that patients could be staffed by an electrophysiologist within a few days of being seen by the APP. And then 4 is that for certain test results, if they were abnormal, we used another concept we had were automatic consults, where patients would automatically be funneled into if they had an abnormal Holter or event monitor, we had an agreement with primary care, they'd be funneled in. So I think that getting proper triage of the patients, APPs working at a high enough level, and then accessing other successful programs helped us with this.
Wonderful. Well, thank you so much for your insights and for your time today. Appreciate it.
Thank you, Dana.
You've been listening to MedAxiom Heart Talk, the podcast where cardiovascular thought leaders come together to advance healthcare. You can follow MedAxiom on LinkedIn, Twitter, and Facebook. If you haven't yet, please be sure to subscribe, rate, and review this podcast. Join us next week for another MedAxiom Heart Talk, and thanks for listening.